I'm going to tell you about the Mast model, which is a model that we use for assessing telemedicine solutions before we introduce them or as we go along in a research project on which data should be collected if you want to make a full assessment of the impact of the new technology. The basis of it all is that the board of directors need to make a lot of decisions as to which new technologies to take into use, and all different departments want at the same time to introduce new stuff. So how can they decide which ones to choose and which ones to let go of? The Mast model has been developed to assist the board of directors in making these decisions on a full level of information. So the definition of the Mast assessment is that if your purpose is to assess telemedicine applications and you have to describe the effectiveness and contribution to quality of care of your new technology, and you need to produce a basis for decision making, you could use the Mast assessment, which is a multidisciplinary process that summarizes and evaluates information about the medical, social, economic and ethical issues related to the use of telemedicine in a systematic, unbiased and robust manner. And the health technology assessment approach comes in the fact that it's multidisciplinary and comprehensive in that, and the scientific studies are usually carried out in a systematic, unbiased and robust manner, which also feeds into this definition of Mast. So it's based on both health technology assessment and on science in general. So the core elements of the Mast model are the 7 domains. First, you need to describe the health problem, the characteristics of your application, safety issues. You need to evaluate the clinical effectiveness, figure out how the patient perceives this new technology. You need to consider the economic aspects on both a societal and a hospital level or organizational level. You need organizational aspects in terms of the staff that you've employed and the setting as such, and social, cultural, ethical and legal aspects as well, because all of this might influence the decision that you're going to take. What Mast adds is also that you make a preceding assessment of how large is this evaluation going to be, and what are the relevant alternatives to the technology that we're going to do a research in. And then after your studies or as you go along, you make also a transferability assessment. So what happens if you choose to introduce this same technology in another country, if you choose to scale it up into the entire country instead of a region, or what happens if you generalize it to a larger population, patient population. In terms of the preceding assessment, that's very important because this tells you whether you should go along with a Mast evaluation or whether you should quit and do some other kind of evaluation. So you need to determine what is the aim of your application, and you find alternatives, other technologies that might help the same situation. And then you need to assess whether it should be done on a national, regional or local level, the assessment as such. Then regarding the technology as such, it's very important to know how mature is your application. Is it fully developed? Because in the beginning, what you do is you make a technology, then you find that some things might be changed to make it more effective, and you change it a bit, and then you try it again on a few patients. And if you're in this phase, you should not do a Mast evaluation. You need then to have your technology in a steady state of maturity. So instead, if you're still within this process of working out the exact application, you should rather do a more formative evaluation considering safety and feasibility of the technology. Also, you need to be very aware of the economic aspects in the preceding assessment as well, because a lot of the time what happens is that for the first patient it's very expensive to introduce this technology. For instance, the first patient who receives teleinterpreting. It's going to be very expensive because you need to make investments in the telecenter and the technology to talk to the patient. And then when the next patient uses it, the center is the same, you've already bought this. So you only need the technology for that next patient. So that means that the costs are falling quite heavily for each patient. But then what happens is that at a certain point you would need to make new investments because you don't have the capacity to all the patients. So you need to be very aware of these economic aspects and where you are in this curve when you decide to do your evaluation, because it has a high impact on the economic evaluation, which is of course a very important aspect for decision makers. The weaknesses of using the Mast evaluation is that it's very time consuming and it does not show why telemedicine works or don't work. It's highly focused on the outcomes and not as much on the process. It's only relevant for the mature applications. But the strengths are, however, that it's based on the requests and comments from the stakeholders. This is what they want before they can make a decision. It's multidisciplinary, so it includes everything, and it's very comprehensive in that sense. It's based on scientific studies and criteria for quality, and it's based on the UNETA framework, which is familiar to a lot of stakeholders in the European Union and hospitals.